By the time that this video is made, 48.3% of Malaysians have received complete dose of vaccine while 14.2% have received partial dose. The remaining 37.5% of Malaysians are yet to take the shot. Many of us are asking, how much protection are the vaccines giving us? In this video, we are going to give you a very comprehensive explanation on this matter. The Ministry of Health has divided COVID-19 patients into 5 categories based on the severity of their symptoms. In general, patients in categories 1 and 2 are considered non-serious and do not need to be treated. Patients in category 3 will have pneumonia, category 4 needs oxygen aids, and category 5 requires ventilator. Besides, the Health Ministry also provide daily updates to relate the category of COVID-19 with the vaccination status of patients. However, there is a problem with this graph as the patients with partial vaccine is grouped with the patients without any vaccination. That's why we are seeing a very high number of patients under the unvaccinated group in comparison to the vaccinated group. Even though this will give everybody a boost of confidence that the vaccines are very effective and encourage them to take the shot, this is not an accurate presentation of how well the vaccines work. On the 1st of September 2021, the Ministry of Health changed the format of the graph and started to split the patients with partial vaccine away from the unvaccinated group. However, they immediately received a lot of negative comments regarding the effectiveness of the vaccine. The most common feedbacks were about the fact that the numbers of patients with partial or complete vaccines were high. If we sum the number of patients with partial and complete vaccines together, we will find that the number of patients with vaccines is higher than patients without vaccines. This leads to the conclusion that the vaccine doesn't work. 4 days later, the Ministry of Health changed the format of the graph again. This time, category 1 and 2 were combined into one group while category 3 to 5 into another group. However, the same comments questioning the effectiveness of vaccines remain. Now, we are going to explain why the number of vaccinated patients is higher than unvaccinated patients. These are the number of Malaysians with different vaccination status. If the vaccine is not effective and 10% of all groups will be infected, this will be the number of patients in each group. You can see that even though the vaccine effectiveness is the same, the number of patients in each group is different. The group with larger population will have higher number of patients. This shows that we cannot assess the amount of vaccine protection by looking at the number of patients alone. Now we understand that it is a mistake to not taking the population size of people with different vaccination status into consideration. Is there a better graph that we can use? In our MHA app, the vaccine protection is assessed by using relative risk. In this graph, the red box represent people with complete vaccine while blue box represent people with partial vaccine. If the box is below the horizontal line, it means the relative risk of the group is less than 1. In this case, the vaccine is providing protection. The closer the box is to 0, the stronger is the vaccine protection. If the box is above the horizontal line, it means the relative risk of the group is more than 1. In this case, the vaccine is increasing the risk of getting COVID-19. Now, we can see that complete vaccination provides good protection against COVID-19. However, people with partial vaccination seem to have higher chance to be infected. It should be noted that the higher relative risk for partially vaccinated individual may not be caused by the vaccine itself. If a person had a false sense of security after receiving partial vaccine and stop following standard operating procedure, he will have higher chance to contract COVID-19. The most important lesson from this analysis is that the complete vaccination really works and we should take it. For your information, our MHA app is updated on a daily basis. You can access it for free by scanning this QR code or access it using the link within the description of this video. If you like health analytics and wish to get a degree in it, this is the course that we recommend. Thank you.